Welcome to the Lowdown on Ghana Web TV. This program covers relevant issues from the hard truth to the facts and fears. My name is Ni Akwe Ismail Akwe. Today we are going to discuss the COVID-19, and coronavirus is still with us. We are in the third wave, which has been caused by the Delta variant. The Delta variant has been described as the most transmissible of the variants of the COVID-19, and many people in areas where there's not been any vaccination, are the ones who are contracting the Delta variant. In Ghana, as of July 14, only 1.3 million people have been vaccinated. Only 1/3 of that number have taken the second dose of the vaccine, obviously because there are no vaccines in the country. As at August 5, 2021, 874 people have died in the country, and the active cases are 6,969 according to the Ghana Health Service. Our guest is a two-time survivor of coronavirus, and he was vaccinated and has taken both doses of the vaccine. We are going to discuss the effects of COVID-19 infections with a survivor in this edition of the Lowdown. We'll be right back. You are watching the Lowdown on Ghana Web TV. My name is Ni Akwe Ismail Akwe, and our guest is a survivor of COVID-19. He survived it twice. He's already taken 2 doses of the vaccine. He's an accountant by profession and in his mid-30s. We are not going to disclose his name to avoid stigmatization. Welcome, sir, to the Lowdown.
Thank you, Mr. Akwe.
So you've gone through the infection of COVID-19 twice.
Yeah.
Currently, what's your status?
Currently, my status is negative. Health-wise, also doing well. However, like you rightly said, I have survived the COVID-19 infection twice.
So what was the experience like when you had the first one? Did you expect to have it at the time?
Well, the first one, the question of did you expect to have it, well, protecting ourselves, so no one ever wanted it. However, it came. If you talk of experiences with the first one, I would say it was more easy compared to my second experience, because that one, it came as a hit to first to my wife, and we realized that no, I needed to also take the test. And to say experience in terms of health-wise, I was okay. I was taking my doses in the house, and I was not really sick. Just that, well, we were supposed to be out of the public and be isolated from people, and that's what we did. And thankfully, after the medication, together with the family, everybody was fine. Not any serious sickness, not that of the experience that I had for the second time. With this very one, I can say that I wasn't expecting to be that sick, because I also hold the belief that I have taken the vaccine. And for taking the vaccine, the 2 doses, if I should get it, then it shouldn't even be anything serious.
We'll come to the second one,
okay,
but let's still stick to the first one.
Yeah.
So with the first one, when you were diagnosed, before you were diagnosed, what made you test for the virus?
Okay, so with the first experience, like I said, there was no clear symptoms regarding getting the virus. However, there was a mass exercise, because my wife works in the hospital and she being a frontline worker. So periodically they were coming to take the samples, and for that matter, we used to take parts of the exercise as to arm ourselves to be. For one is to be armed. So we used to take the opportunity, go in, take our samples, and on that very occasion, it came out that I didn't even take initially. It came out that my wife was positive, had a virus. So I also went forward to take my sample, and also came out sadly that it was positive.
So you got to know out of a mass exercise.
Yes.
So it wasn't out of feeling ill
No.
or just having doubts about your health.
No. It was an opportunity my wife took because he's in the office, and it was required of them to take the samples periodically because they were, whilst we were at home, they were still going to the office because he works with the Ghana Health Service.
Okay, what's the size of the family you live with?
I live in a family of 6 people.
So all the 6 tested positive?
No, in that instance, I think among the family, the adults are 2, and then we had one who was below 13. She tested negative. We did sampling. We took the 13-year-old and then the 4-year-old and tested, so that if the 4-year boy has it, then obviously the rest are likely to have it. And then the 13-year, who is also a potential person to get it. For me and my wife, when I tested, it came out positive. So that is testing for the family. It was only my wife and myself once again who had the positive.
So that means after testing, half of your family or less than half of your family had it and the other half didn't.
Yes.
Even though you were living together in the same house.
Yes.
So how did you manage to isolate yourselves and also to be sure you got better?
Okay. The painful aspect of it is the children. If you keep them at home, it means you are going to be with them 24/7. The risk is high. They have to also go to school. And at home, when they see you wearing the mask, children, that why are you wearing the mask? Are you infected? And they got to know more of the virus because of the education, the news was all about it in school and all that. So it was quite challenging maneuvering, making them not feel like they have the virus, and at the same time protecting them. So either you move away from them more often. We gave them our phones, the tablets, to be with kids where they get opportunity to watch those videos. Then they move themselves away from us. Then we separated the rooms. So whilst we share our bedroom, usually they will come in, sleep before we move them to their bedroom. But this time, we will have to sit and wait to make sure they've all slept so that nobody come to share our bed or any of our environment with us. It was quite challenging, but thankfully we managed it. And also what we did was that from the first time our results came, we started the treatment for the whole family. So whether you've had it or not, whether you tested negative or positive, once we are living with you, we can't isolate you. We can't move you out of the family, because at the moment you say, I have tested positive, nobody is ready to accept your child. Who would like to mingle your children with theirs? So we couldn't send them anywhere. And it will also be weird to say that I've tested positive, come for my children and keep them among your... It's like taking an infected something psychologically. So we could not do that. We have to maintain them, keep them in our home, and ensure that they are also treated.
Okay, were you able to break the news to the children?
The first instance we couldn't, but with this very one we did.
Okay, yeah. And I'll come to the second one, and then we'll go through that as well. But what was the first thing that you did when your results came out for the first instance? And what did the hospital do in terms of support?
I think the first instance regarding support from the hospital, it was good. They kept calling, but the first thing that broke all of us our heart was breaking the news to us. I think the lady who called mistakenly used my name for my son and said, this one has tested positive. I mean, a 3-year-old boy going to test positive was more serious to see that the father has tested positive. So we became worried, tried calling every specialist that we knew in church, that we know that they are up there who could help us. Then about a couple of hours later, she called and said, no, we got the information wrong. It's rather the father who has tested positive, but the son didn't test
A couple of hours later?
Yeah.
So what could have caused the problem?
Yes.
Did they explain to you what the reasons were?
Well, he just said it was miscommunication.
Wow.
And said sorry for that.
Wow. Well, that's very serious, and we'll talk more about some of these issues are surrounding the COVID-19 infections and how people are communicated with from the health facilities right after this break. This is a Lowdown. Welcome back to the Lowdown. My name is Ismail Akwe. We are speaking to a two-time survivor of COVID-19, and you are telling us about how your result was mistaken for that of your son,
Yeah.
And then your son was diagnosed, and later, after some hours, you were told that it was a mistake.
Yeah.
And was there any apology?
Well, of course, the normal apology that, oh, we are sorry that the earlier information we gave you was actually wrong.
And this was a 3-year-old son?
Yes, 3-year-old son.
Wow. That's really serious.
Really.
So what did you do after you were given the information? And what did the health authorities also do?
Yes, so since that is my wife being a frontline worker at a health service, then we were provided with the medications. So we were giving for every single person in the family. And some of them were not also available in the hospital.
Did you buy the medication? Or
yes, some we have to buy.
You had to buy some?
Some we have to buy.
Okay.
Medications are actually bought for, by the, I don't know, but I think it's bought by the patient.
Okay.
But because he works there, there's this package for them. So we got it for myself and her, and they didn't have for the children. So we had to go and acquire those ones. Okay. And especially for vitamin C's and other aspects.
So do you remember some of the medicines that were given to you?
Yes, it's the same medicine still being applied. I think azithromycin, the zinc, and the vitamin C.
Okay. Okay. So how were you taking it? Is it 3 times a day? Was it once a day? How often was it taken?
I think azithro comes in various types. Okay. So with mine, it was a dose morning and then in the evening. So 1 morning, 1 evening for 6 days.
Yeah. And was there any side effect?
Well, side effects is quite different. I think regarding my wife, she gets a bit of nausea and runs quite a bit, but well, I didn't get any of that.
Did she get a nausea before the medication started, or it was after the medication started?
I think before she complained of some slight cold, but when she started the treatment, I mean, things became a bit bad for her before she actually finally recovered. So that her nausea became quite serious.
But you didn't have any effects of the COVID-19?
Yes, with the first one.
Okay.
Yeah.
And the other children had nothing?
No.
No effect?
No.
Okay. And how long did it take before you tested negative?
With the first one, I did the second test after, I think, 11 days.
Okay.
Yeah.
11 days?
Yes, after 11
days.
days.
Same for the rest of the family?
Yes.
Okay. And all of you tested negative after?
Yeah.
Okay. And when you were tested negative, were there any advices or any other things you were given by the health authority that you visited the first time?
Well, I think wasn't anything like that officially from any, but the usual concern, how is the family, I mean, the health people used to call. And that particular facility, I think one time the administrator called that she wanted to visit to follow up on the cases, ask how we were doing. And besides that, nothing more officially, but well, families, people who knew my wife because it's the same facility, they were calling to check up on us. Okay,
so maybe you had special treatment because your wife works with a health facility.
Yes.
Okay, so now let's come to your workplace and also that of your wife. Contact tracing. We know whenever someone is tested positive, the health facility is supposed to go around and trace the contacts of those who test positive. Was anything like that done? Did they discuss that with you, and did you give out some names for testing to be done on them?
Yeah.
Okay, and how did that go? Did they do the tests?
Yes, they did.
And they were positive or negative?
The results are actually sent to the various individuals. And I think, I don't know how the Ghana Health Service is doing it now, but previously in the first wave, the first time, when you test negative, usually you are not called. When it's positive, then they do call you to follow up and then the contact tracing. So as to, for the purpose of medical privacy, medical information privacy, those who were contacted, their status, I cannot have information on that.
Okay, so for the sake of clarity for our audience, we would like to know, when exactly did you contract the COVID-19? The first one.
Ooh,
Which month?
Month. That would be around when we came back from the lockdown.
Okay.
Yeah.
The lockdown was in March?
In March. I think when it came back, so that would be around April,
okay,
somewhere, yeah.
Okay, so around April. So when did you contract the second COVID-19? And I know you went for 2 doses of the vaccine.
Yeah.
Do you remember when you took the vaccine?
Yes, the first time they rolled it out, and then the second time they rolled it out.
Okay.
Yeah.
And your wife also took the vaccine?
No.
Okay, so you are the only person in your family who took the vaccine?
Yes.
Okay. And you still contracted the coronavirus a second time after the vaccine. So when exactly was that? Which month?
July 29th. Well, that's when the test came out. Positive.
July 29th?
Yeah.
Okay. So when it came out, what necessitated that test as well? Were you feeling sick before you took the test?
This time I was.
Okay.
I was, I think that was around Thursday. The Monday, Tuesday, the usual feeling, chills, body pains was there. But usually as an active worker, it's all maybe stress. So I took painkiller in the morning, and then sometimes in the evening when I get home, I'm feeling that cold and body pains. So I did that for Monday, Tuesday. Wednesday, I decided to leave it so I could see the actual thing that is wrong with me, and it was very bad in terms of being able to go about my day. Then Thursday, I decided that, okay, in that case, I'll go straight to the facility, which is Lowdown lab, to take the sample before coming to the office.
So you opted for it yourself?
Yes.
Okay.
Because of how I was feeling.
Yes.
Then when I got to the office, I couldn't work. In fact, my HR had to send me home. With I couldn't even drive home. A driver has to take the car close to my house before I took over. And sadly, by evening time, the test was in, and my suspicion was right, positive.
Were you shocked about it?
I was, because I was one of the people who also carried the myth that when I take the vaccine, I shouldn't get the virus, and even if I get, I wouldn't fall sick. So for me to have been sick and tested positive, it was quite shocking. Yeah.
Are you somebody who detests wearing the mask? Do you wear it not regularly?
I think rather I used to wear the mask religiously. However, after the vaccine, with this good information regarding the protection, I think I dropped it quite a bit. Because in my first part where I would wear it morning to evening, get home and even make sure I manage the mask well. This time, I mean, if you are protected, then you should be able to be a bit free. So I took advantage of that, of the vaccine, and I lowered my guard quite a bit. I think that was the cause. So
the vaccine is one of the reasons why you reduced your alertness in terms of your protective, being protective of yourself against the coronavirus.
Yes, it could be one, and then also I think the general feeling of the virus also has become a bit of becoming another new normal. Apart from the first new normal that we had, that hey, you have to wear the mask. There's more like another new normal coming where, yeah, the virus is there, but we can still go about our daily activities. not that loose in terms of being adamant about it. But well, it's not also easy to wear the mask as compared as it came first, because we're enduring that. And for the purpose of having the vaccine, then when I'm alone, I try to drop it. And I don't know, maybe that could be the reason.
Okay, so this time let's come back to the family.
Yeah.
After you tested, did the entire family also test?
This time, no.
No testing at all?
No, we just went straight to
the medication.
the medication.
Okay, so you can't tell if it came also from the health facility where your wife works?
Unfortunately, how well, I cannot tell because body reacts differently. She could be a carrier, but she wasn't sick. But I started having the feeling of nausea, the chills, the dry cough, and the body pain. So that actually prompted her that, no, you need to test. And that is why I come and tested. And we also know that she didn't want to test, but from the experience that we've had, once I've had it, she's my wife, we share the same bed. Obviously, then the best thing to do is just treat. So we went ahead to do the treatment for all of them.
So I'm sure. Yes, go ahead.
I'm sure this week there'll be an opportunity for them in their facility where they will take the sample and all of them will be tested to prove that they are negative.
Okay. Did you take the same medication as previously?
This time, well, when we contacted the medical specialist, that's the doctor, they prescribed the same medicine, which is the Azithromycin, the zinc, and the vitamin C. However, I think after a couple of days, my expectation was still not met. I was expecting to get quite better and stronger. So I spoke to one senior medical person who said, no, there's an add-on to this very treatment, which is ivermectin or something, which we got it, and thankfully it really helped.
So the previous medicine didn't really change how you were feeling? You were still feeling sick?
Yes, I was still feeling sick after 2 days. Well, however, I will not be able to say emphatically that it didn't change because I didn't steal through the course of the Azithromycin. But for precaution's sake, I hate the advice that the senior medical person gave me. Yeah. And I added the other dose to it.
Okay, so how long did it take you this time to be healed? How long did it take you to be healed?
I think the 5th day, I got quite better.
5th day?
Yeah, the 5th day.
And then for testing, second testing?
Second testing, yes, I did a second testing. That was last week, Saturday. And thankfully came out negative, which means the medicines worked.
That's the first week of August?
Yeah, first week of August.
So definitely you are negative. That's why you are in the studio here with us.
Of course.
Yes, or else we would have to do this via Zoom or any other digital service.
Yes, and I brought all the results to show the HR that I could actually come out because the results tested negative. Yeah. Okay. From learning again.
So that's the test center, that's learning, do they give you any advice after giving you the results?
Well, no. Because you take the sample, you come back home, you get the results through email and text message. Yeah. So the rest is up to you to take it up to either go to a health facility or you seek for advice.
So after private testing, there's no follow-up by any health official, there's no report sent to a health facility by the private testing centers. So it's up to you to do anything you want to do. And this is quite dangerous because if people test privately and then they see they have the virus, they might sit and infect other people or even affect themselves. They can even die out of it for not taking any precautions or precautionary measures. So what do you intend to do now after testing negative? Because you know with the vaccine or not, you could still test positive.
Yeah. Well, I think the lessons are learned already. If I'm allowed, the message is that we can't drop the mask because I'm a living testimony to let you know that with or without the vaccine, you can still get infected again. Yeah.
Okay. So you were talking about how you broke the news to your children. Yes. How was it? How did you do it? And what was their reaction?
Well, I think this time, the funny thing is that my senior girl, who is not actually like a senior person from a family who is with the children, so that in her absence she could take that seniority. We were there one time. She said, "Daddy, I can't smell." And I was like, "Why?" Then, funny enough, she said, my little daughter has done the thing, but she couldn't smell it. She couldn't. She's removing the whatever, the number 2, but she can't hear it. She can't smell anything about it. So, okay. Then, I mean, because we have information about my status, we said, then obviously we need to let these guys know. So we started medicating her, and she took her doses also. And like I said, she is still waiting to get the test done, coming either tomorrow or Wednesday.
Okay. And then the little ones, or for them, you didn't really tell them much?
Yes, they got to know. So what we said was that, hey, daddy's mouth is now dirty. So we didn't say, hey, it's virus. We didn't say it's corona, because how they will manage it. So usually, I mean, as father with children, they want to play, they want to give you peg, they want to take your car, they want to share artifacts with you. So now my plate is separated, my spoons are separated. When you're eating, they want to take part of your spoon, they want to eat from your spoon. You say, hey, my mouth is dirty. Oh, daddy's mouth is dirty, okay. But daddy, did you brush this morning? I said, yes, I brushed. So how come your mouth is dirty? It's dirty because I'm sick.
Okay.
And so that's how we manage.
So those are the measures you put in place, where you don't share items anymore.
Yes.
So everybody has theirs.
Yes.
Yes. So do you know anybody personally who has suffered from coronavirus in terms of first being infected? You know somebody personally who has been infected besides your family?
Yes.
Okay. Do you know anyone who has died out of it?
I've heard of the death, but I don't know personally somebody who has died out of the corona.
Did you also hold the belief earlier, when the virus or the pandemic started, that it's not in Ghana yet and people will not die? Others were saying the death or the numbers were not true.
Well, initially, maybe I didn't hold it for long, because my wife could testify that, hey, the thing is true. The memos and the reports coming from the various Ghana health facilities shows that really people are getting the virus. So though we all had this faith, I mean, I'm a faith person, and we all championed the fact that, hey, we can overcome, we have the sunshine. But initially we were told that the virus cannot survive the sun, and they are dying because the atmosphere or their weather is different from ours. However, it didn't take us much time to notice the evidence all over. So, of course.
Yeah. So if you had known that you go through these phases earlier, before you went through them, what would you have done differently?
Well, I think I'm well informed regarding how the virus is and how it behaves. However, the challenge we have at the moment is the kind of environment we all find ourselves in. I think when it came first, one of my number one fears was the fact that I was sitting in Trotro. I mean, it really scared me, because there are some environment that you don't have control of. There are others you have control of. When you're in your own vehicle, you have control of that. In your office, you have control to some extent, where you can actually instruct everybody around you too. But in the Trotro, others were not wearing it. In the markets, in other social gatherings where we find ourselves, was quite difficult to ensure. And the protection is not only for yourself. It has to be mutual for effective protection, because you can wear the mask, but if your environment is not good enough, I mean, the little drop of the mask, you can also get infected. So though I took all the precautions, like I said, the first time, I still got it. It could be from my wife. Well, it's possible. It could be that I also even took it home. However, the essence of it is for all of us to ensure that we protect each other. I wear it for you, wear it for me.
Okay.
Yeah.
So what advice would you give people who are saying, well, if you have the vaccine, because you are a typical example of those who have been vaccinated,
Yeah.
and they still contracted the virus. So what advice would you give people who have such views that with the vaccine you are free, you can go and do anything you want, you don't need to wear the mask and all of these things?
I would say that it's not true. The evidence is what we are sharing today. I took my 2 doses. I have my card that shows that I have been vaccinated by Ghana Health Service, but I still got it the second time. The results are there to prove. The tests from learning are there to prove it. So this is a clear message to you that if you are taking cover from the fact that you have been vaccinated twice, I would like to let you know that you can still get the virus. And probably your case may be like mine. You may be more sick than that of the first instance.
Okay. So what are some of the precautions you take now
Now,
to avoid the Delta variant?
Now-
God forbid any of us getting that, because people are really dying out of it.
now you can see that I don't intend to drop my mask, even in this interview, where I know that all of us are protected. And the vitamin C is what we are stocking now.
So whether you have it or not, you are taking the vitamin C.
Yes, we have to, because the advice we are given from the medical practitioners is to boost your immune system, and good sleep is one of the things that you have to enforce, because when your immune system is not strong enough, you are more prone compared to those that are more strong in terms of their immune system. And the vitamin C, the veggies, and the fruits, and the good eat and good fruit are some of the extra precautions you can take. But the first and easy precaution is wearing of the mask, whether you are vaccinated or not.
So wearing of the mask, we are going to continue with the vitamin C.
Yes.
And what about the sharing of materials used in the house, from the spoons and
for family setting, a nuclear family in this age is difficult. It's difficult. It's difficult in the sense that the kids are small. Sometimes the water bottle that you have drunk, that's what they pick, and it's difficult. But if we are all protecting ourselves, right from our offices to the house, managing the nose masks well, and ensuring that the children are also masked up, getting them to eat well, getting them to sleep well, giving them the vitamin C regularly, then it means that the virus will not be able to affect any of us, and for that matter, a family will be protected.
Okay, so last question. With the way the variant is going, the new one, the Delta variant, and so many people are being infected, including yourself, you recently got infected again. Would you say that there should be another lockdown, in your view?
In my view, I think, I think we should accept the new way of working. I think if I read well, LinkedIn CEO has advised all his workers to work from home. It will be difficult because of our setting in our culture where internet is not that strong. A lot of people are not even used to the internet. But the virus still being in the system, we may not have the capacity as a country to go back to lockdown. And that is why we need to manage it in such a way that we also don't lose lives, and which are more precious than even a whole Ghana GDP, because the Bible says, what shall profit a man to gain the whole and lose his precious? So the soul of a man is more important than all the things in the world put together. However, we cannot say that we want to protect the souls of each person and will feed on nothing, will not produce, will not grow, will not continue our economic life. It's needed. But I think that one of the things we can do is to probably make internet cheaper from the government support, or probably ensure more sensitization, education, and rolling out more tools that can aid each and every one, no matter where you are, be able to work maybe some days off the office to reduce the congestion among us. That way can help.
Thank you very much, sir, for coming to the show. This was quite an informative edition of the Lowdown with our guest, a victim and survivor of the 2 waves of the coronavirus pandemic. Watch us every Monday on Ghana Web TV and on all of Ghana Web's digital channels for more interactive conversations. My beautiful clothes were made by I Marie Fashion. Call them on 05709633796 for yours. My name is Ni Akwe Ismail Akwe. Be safe.